Thank you, Mr. Chairman, and thank you to the panel this morning. There's been a lot of discussion as we have looked to differing ways that we can help families when it comes to health care costs. I've been working with a colleague of mine on making sure that we are able to have health savings accounts that are robust enough to help cover those costs. But in fairness, if I have a good nest egg of an HSA sitting over here, but I don't really have an ability to shop wisely and use those saved dollars wisely, what are we doing? So this conversation here this morning is so very, very important when we talk about transparency. In my hometown in Anchorage, the largest city in the state, last year we passed an ordinance that requires our healthcare professionals in our facilities to provide cost estimates to patients who request the information. They have to post it. They have to provide information within a certain number of days. And granted, it is still very early, but at this point in time, it doesn't appear that it's had much of an impact. Some of that is due to those issues that we've already heard, the difficulty of predicting services during an episode of care, varying insurance benefit structures, bills from multiple providers, the like. But to Senator Warren's comment there, I live in a state and a place, Anchorage is, again, our biggest population center, but we just don't have a lot of competition. Mm-hmm. So if you're looking to go to the hospital in Bethel, no real point in shopping around because you got one. And the same is true in just about every community outside of Anchorage, Alaska. And so I looked with great interest at the chart that Senator Cassidy showed in terms of the cost, the facility costs and how those weigh in. But the question that I wanted to ask you all this morning is, okay, we're moving towards greater transparency, whether it's through Blue Books or through other mechanisms. Maybe it's going to start out slow, but we are moving in the direction of better ability to obtain access to the pricing. But what's the role here for Congress? How does Congress mandate the education and the engagement part that are so critical to this? Because if you've got a situation where, oh my gosh, I am not well right now and I feel it, and I don't know what may happen. Am I going to have a heart attack? I don't know. Does that mean that I start shopping around now while I'm feeling ill? Do I am I one of these people that is going to look at my health, my family's history, and say, I better do my own analysis early on, because within the next 10 years, I'm likely to need some of these services for cardiology in my community. How do we engage people early enough to make a difference? Because most folks are going to have a hard time engaging on a topic that they may not need and that everyone hopes that they're not going to need. What advice do you have here? Because it seems that so much of what we're doing is kind of after the fact or at the very minute that something is happening. Who can educate me here? Ms. Binder.
Well, I would just say that the role of government should actually be as narrow as possible in looking at this issue.
Sure.
I think the role of government is to ensure that the data and information is scientifically sound, reliable, and available, and then make that available to public entities like all of us, and then we have incentive to reach out to the public and engage them. I think there's a lot of private sector entities, both in the for-profit and not-for-profit space, who have a lot of interest in going out and reaching consumers.
You do the engagement rather than me, the consumer.
But we need the data, and that's what we're missing. We need more data, much more publicly available data that we can use. And that's where I think there's a role for government.
Others? Ms. Ganado?
I would offer two suggestions. First is help us all teach consumers that healthcare is shoppable. I think that many consumers still don't understand that, so whatever you can do to help us teach consumers that healthcare is shoppable. And I would also say there are many organizations like the Alliance called Regional Health Improvement Collaboratives around the country that have all of the stakeholders convened around the table to try to work on this issue in their local environment. And when things get solved locally with people who all have skin in the game, it's an opportunity for improvement.
If it's okay, I'd like to weigh in. This is probably the biggest learning of the past 10 years. Most people are healthy most of the time, and so they don't think about this, and it's key to educate up front. What we know is that if consumers know they need to shop, and they know prices vary, and they know quality varies, then they'll shop, and then they'll get better value. But you can't do it at a rifle shot. It has to be continuous. So someone with heart disease has to know about this issue when they ultimately need to consume, people with other conditions as well. So steady drumbeat of regular communication, I do think we do that. That's our responsibility, but we need the data, obviously, to be able to do that, but that is probably the biggest key learning, is making sure that there is a regular drumbeat of education so that people understand this when they do need to consume.
Mr. Chairman, I have to wonder how much of this is generational, because I think in our generation, we didn't have the ability to shop. Sure. We didn't know that we could. I think young people can look at this and say, yeah, you shop for everything. Thank you.
Definitely.